Women make up 70% of the healthcare workforce, but only 20% of its leadership. On Her Story, we'll explore the careers of bold and influential women from Silicon Valley to Capitol Hill and learn how they've overcome the odds. I'm your host, Angela Jane, and this is Her Story, a program where we explore what's beyond the glass ceiling. This special edition is guest hosted by Lynn Chow O'Keefe, founder and managing partner of Define Ventures and founding member of the Her Story Advisory Council.
Well, thank you everyone for joining us at Her Story, where we talk to amazing, innovative healthcare leaders, being joined by truly a great collaborator and friend, Sumbul Desai. She is currently vice president at Apple, is a physician, was also at Stanford before this, but has also had some interesting career paths, which I'm sure we'll get into, Sumbul, as we talk. But thank you so much for joining us and sharing your story with us.
Thank you so much for having me. I'm so excited and I love this podcast. I'm really excited to be able to join. So thank you.
Yeah, absolutely. We loved having you. So Sumbul, let's start from the beginning. And the beginning for many of us is, often our family or how we were raised. Like, bring us to those early formative years and just kind of how it might have changed or helped you develop your arc of leadership going forward.
How much time do we have? So my family has played such a big influence in terms of my life and where I am today. So I'm happy to share. I grew up, it's interesting. I was born in Sweden. My family moved out to the United States when I was 3. We lived in Wisconsin, then moved to Virginia, then to New York. So,
oh my goodness.
My dad was a scientist and he, was he ended up in a company that moved him around a little bit in the US. And so had that background of different states. So if you ever hear me say class or glass, you hear a little bit of my,
well, I'm from the Midwest as well. So we share that. I get it.
Yeah, exactly.
Curse,
Totally. But I think, the years that I think back to the most is in high school. I remember very much struggling with what do I want to be? And growing up as Indian, I'm in Indian descent, and my dad's a double PhD. My mom was at that time a nurse, and I'll share a little bit of how that plays a role in terms of her influence on me, which was quite great. That I grew up thinking my dad always wanted me to be a doctor or an engineer. There was really only 2 paths if you were Indian. It was either be a physician or be an engineer.
Very similar to growing up Asian, yes.
Yes, and there was really not much else. When I was applying back in the day, when I was applying to college, there was something called a Common App. And I'll never forget, my dad, I actually still have this so vividly in my memory. My dad yelled out from the other room. He's like, did you apply to any 6-year medical programs? Because you need to apply to med school. And so I did. So I begrudgingly checked one of the boxes thinking I would never get in anyway, but at least I checked the box and did that and went through the application process and was asked to interview in the Rensselaer Albany Med 6-year med program. And I have to tell you, I cried the day that I had the interview because I did not want to go. I wanted to go to Columbia University and become a journalist. And my parents were like, journalist? Like, what is that? You can't become a journalist. And so went through the interview process and, when you're young, you think you're vibrant and you think you're being rebellious. And so in the interview process, I told them how I was really interested in medical journalism, thinking that maybe that smart alecky answer would have pushed them in the direction of rejecting me. And I ended up getting in. And I, again, cried the second time the day I got in. And, but I didn't really have much of a choice. My dad was like, you're going. And so I did I started at Rensselaer and did the 6-year BSMD program. And what was really interesting was I was just miserable. And my first semester that I came back to in December, my dad was just like, okay, fine. If you're this miserable, do what you want. And so I changed majors to computer science, which again, obviously everything has a reason in life, right? And everything pops up for a reason, but it was interesting. I changed major to computer science and minored in communications and started doing an internship at the local CBS affiliate, thinking that I was going to go be a journalist and pursue that. And that led to then an internship at Good Morning America, and then an internship, then eventually a job at ABC News down the line. And so I changed majors, but I definitely had a rocky path in undergrad. So I learned to be resilient and gritty pretty early on, but I also learned to be pretty rebellious early on. And so I ended up graduating, started off at ABC News, and I lived with that, that constant, I think, rub with my parents, quite honestly, of, well, I don't understand what you're doing. I don't know if they fully understand what I do today either, but back then it was really, never really understood what I did. And, moved up the ranks, but I myself started to realize that some of the analytical capabilities that you have as an engineer, I started to miss that in some of the work that I was doing with news. And while I love news and I learned a ton, I think what I was really struck by is I wanted to understand how things got built and how do you build them, and like, why do you make the business decisions you make. And that led to me deciding to change roles. And the Walt Disney Company owned ABC. I moved over to the studio planning group over in Burbank, California. So I left New York. And that was a big deal because I was the oldest daughter. Exactly, right. And again, my parents were like, why are you going to California? Like this whole thread of like the Walt Disney Company, like, why are you doing that? So I did go out and do that and learned a ton. And that was like an amazing experience. And I'm happy to talk about that in a moment. But working at the Walt Disney Company, I think, taught me a lot about some of the things that I've now carried forward into my work here at Apple. And it was really interesting because in 2001, right in August of 2001, I went home to visit my family. My brother was going back to college. I went back to visit, and my mom woke up with one of the worst headaches of her life and had a massive stroke. And it happened in front of me, and I was not a physician at that time, obviously. And when that happened, she went into a coma. She had a hemorrhagic bleed and went into a coma, like right in front of me. And as you can imagine, my dad was on a business trip. My brother and I were there, and we got to the emergency room. And it's funny, as a physician, I look back at what happened now, and I'm like, there's just a number of little miracles that happened in order for her to still be with us. But we went to the hospital, and we had to make a decision on whether to put her on life support or let her go. And I think for me, that whole experience, obviously just even the trauma of that, but even beyond that, I stayed by her side and I took care of her for the year that she was in the hospital. And also, I mentioned the August 2001 for an important reason. It was in New York, and it was right before September 11th. And my mom ended up getting moved out of an inpatient ICU to a rehab hospital because they were clearing the hospitals on September 11th to be able to to accept. And she was in a rehab hospital much earlier than she should have been. And so I ended up actually helping a lot with taking care of her. And I think that's when I really fell in love with medicine. And it was a rehab hospital. And it was that to me was like life-changing in the sense that I, for the first time, while my parents wanted me to be a doctor, I, for the first time, understood when medicine can work together, what it can really do, and the impact it can have on someone. And after that experience, when I went back to Disney, it just wasn't the same. Like, I felt like I needed to give back and do something directly to give back, which is when I decided to go back to medical school. And so, as you can see, and that kind of led to my path now, as you can see, that my family had an immense impact on my life for a number of reasons. And if it wasn't for my mom, and there's multiple ways that my mom has influenced me over the years, but that obviously was a big part of my story.
Yeah, amazing that just all these little miracles, to your point, the influence of that, the outcome of it. It sounds like your mother hopefully is doing well. And then to launch you back to kind of, in some ways, where you might have started. So take us through that. Obviously, you went to medical school. And, a clear question, and this happens a lot in the industry, is, did you know that did you have a clear idea of you wanted to practice, or you wanted to use that degree in a different way? Because you have had so many different experiences between ABC News, Walt Disney, you had so many other aspects. How did you think about that in med school?
When I went to medical school, I will never forget the feeling that I had when my mom was in the ICU of feeling helpless. And I never wanted to feel that way again, which was a big driver of why I went into medicine, to be able to give back to people so that they never feel helpless in those scenarios. But it was interesting. I actually went into medical school thinking I was going to practice. I never thought I would do what I'm doing today. Never. If anything, when I was going through medical school and residency, I wanted to go into ICU medicine. I still joke around with my husband that when this is all done, I might go back and do fellowship in the ICU, and he laughs at me. He's like, "Really?" But I love critical care, and that was what I really wanted to do. So when I actually went into medicine, it was very much the intention to practice. And I ended up, doing internal medicine residency and started as a hospitalist. But it was interesting when I was in residency, I started to see all the inefficiencies in healthcare. And I think having a corporate background and like working in industry before did help because, residents really, even when you're first starting in residency, it's like, even how do you use the operator and how you got to use a fax machine? It's all these things that you learn for the first time as a resident, where having worked before, at least you had some of that experience. But the inefficiencies really struck me around the healthcare like continuum, both from, continuum of care, but also even within the hospital, some of the inefficiencies around teams, communication, technology. And so it was during residency that I had a little bit of an aha moment of, hey, let me talk to some of the administration in the hospital and see if maybe my background could be used in some way, but I still wanted to make sure practicing was a big part of it. So when I was at residency at Stanford, I spoke to our chief medical officer at that time, and he actually came from GE. He had kind of an interesting background as well. And he understood what Disney and like what working at Disney would bring to the table. And so he said, hey, why don't you come and work for me doing strategic initiatives? And I did that, and did that 50-50. I was 50% clinical, 50% administrative. And he left within the first few months that I started. So I was like, oh, what do I do now? So, and got to know, actually then Amir Rubin was CEO. He was kind of the incoming new CEO. So I got to know Amir, and took over and did a little bit more work around the strategy side, but also that's where I really started digging into how technology could be used in healthcare. And that started that journey at Stanford of like, how do we integrate telemedicine into our practice? How do we think about virtual care? How do we do things with employers? How do we expand our primary care network? And so that was that beginning of that journey. So I never thought that I would end up where I am today, with the path that I started on, but it kind of all happened organically. And
one thing that we like to talk about is, do you feel like you're an accidental or intentional leader?
Yeah, I would say I'm a little bit of both. And I think what I mean by that is I definitely was an accidental leader, I think, in terms of how things evolved for me. But I definitely think now I try to be much more intentional about my leadership. I think there's, I've really find that reflecting and taking some time at the end of the day to reflect on like, did I do this well or did I not do this well? And I get a lot of, I've gotten into the habit of getting a lot of feedback too from my leaders or counterparts or colleagues. I think now I try to be much more intentional about how I lead. But I also do think there's a part of me that, there's always accidental. Like, I think when you're in new spaces and you're innovating, there's things that happen accidentally, and then you got to take that and run with it. And so I would say I'm probably on the side of I do a little bit of both if I were to categorize that.
I think as you were doing these different strategy projects and, helping launch the virtual care center at Stanford, I would say you've then gone to Apple. I'd love to hear about that transition. And you did it, pre-COVID and everything, right? That path of going to a technology company. Walk us through that, Sumbul. I think it's very interesting how you thought about that transition being a physician.
It was a hard decision to make. I really loved working at Stanford, and but I also did miss some of the rigor and the intentionality that you often see in corporate America. Like, I think with academia moving, and I think the thing that I've always, moving fast enough was always a concern. And I think the thing that I've always struggled with is, will innovation happen from within healthcare or from outside of healthcare? And I felt like we had done some things from within healthcare, and I think Stanford's done some really neat things, but it's very much more with an academic bend, which is really important because you need to have the academic community come along. But I think the idea to be able to go work at a company where you can have impact at scale, because impact was a really important thing that drove my desire in health. And the reason I became a physician is to have impact, and then to be able to do it at scale and empower users to really engage in their health in ways that they haven't thought about before. And that intersection of technology and what I love about, design and art, and bring that together with the science. It was such a unique opportunity that how could you say no to it? And, I think we're on a journey, and we're still early in with the work we're doing, but I'm really proud of the things that we've done here at Apple, and we have a lot more to do. But I think the ability to bring and be a nexus point of bringing technology with the medical community and bringing research together, but then also thinking about how does that impact the user, and in a way that you can provide features and products that are usable, understandable, impactful. That was what was really exciting to me about the opportunity.
Yeah, I see you, and you're actually sitting there at Apple headquarters. And I don't know how many people in our audience have actually gone to Apple headquarters, but it's like a work of art in itself in terms of the design and the thoughtfulness of the senior leadership, even putting that structure together. And so talk us through that, because in healthcare, and I think for many of us who've been in healthcare, we can say we want to be more consumer centric, right? What has it been like being now on the Apple side of the house? How have they created that via process or culture, or what are some of the things that you think we can take from a healthcare system standpoint that you felt like you've learned or progressed skill set wise at a tech company like Apple?
I think there's a few things. I think one, being grounded in science. And so, especially for healthcare type features, making sure that the work, there's no shortcuts around doing good work, right? So, and that's true for the science, and making sure that you take the time to do the feasibility and understand the impact of the technology, both scientifically as well as on a user's life. And thinking about it from both of those perspectives, I think, is really important. And I think that, the thing, you always think about the design and the focus on design at Apple, and that is something that is astounding and amazing, and it's in everything we do, where it's focusing, simplify, think of, surprise and delight is a really important element in terms of how our features and products are developed. But the thing that I always am in awe of is the attention to detail around the science behind the feature, so that you need to, fundamentally, the science and the technology has to be solid. And that's when you have a really great user experience. So I think the biggest thing to take away for healthcare is go back to the fundamentals and remember what's the core of what you're trying to deliver, and make sure you do that really, really well. And then, the other things build upon it. And so then the design is so seamless, because it's such an important, the fundamentals and the design come together in a really beautiful way. And I think that's really important to think about in healthcare.
Sumbul, as you kind of look back on your career, if you will, at ABC and then Walt Disney, kind of in the media world, and then at Stanford and the strategic initiatives that you helped to build and innovate, and now being a senior leader at Apple, were there certain edges in your career that gave you kind of disproportionate advantage in your leadership, or mentors, or what are some of the kind of things that you felt help you get on your way in your career as you kind of look back on the whole journey?
I think always being humble about what you don't know, and being clear about what you don't know. I still always believe, and that ties to the second element that I think I really cherish. And this is what I learned from my mom, is that you're a constant learner. My mom, was a nurse. She actually was a teacher, trained as a teacher, became a nurse here when she moved to the States, and wanted to do more, and went back to school to then go learn finance and go work. She ended up working at Verizon Wireless before she had her stroke. And my mom was one of those people that just studied constantly. So the thought that I went back to medical school later in life actually wasn't so unnatural, because it was something about how do you constantly learn. And I think using your relationships and your colleagues, your former colleagues, your friends, your mentors, and constantly asking for advice and how do I do this better, I think has been really, really critical for me, because I do think I can always be better. Like I'm not satisfied with where I am as a leader. I'm not satisfied with where I am as a as a engineer. I'm not satisfied with where I am as a physician. Like I want to make sure that I continuously push myself to be better. And I think having grit along the way, because you're going to have bumps. It's not always going to be easy. And I also learned, I think, that grit from my mom of watching her, throughout her life, be willing to take some steps back, but actually use that to learn and do something different. So that's also enabled me to be, as you just said, I've had a pretty circuitous path, right? Like I've done a variety of different things, and change has been, I think, the ability to have faith in myself and the grit of being willing to make some changes and adapt and learn and constantly enrich and learn, I think has been really helpful as a leader. And I still think I'm learning. I mean, there's so much more to learn. I'm nowhere where I want to be, and being realistic that, we're always a work in progress. And the ability to enjoy the process of being a work in progress, I think is what I'm starting to really appreciate as I move across in my career, as well as in my years, as I move along in my years.
I have to say, like, it's so refreshing to see a senior leader such as yourself be vulnerable to say, hey, I'm always a work in progress, especially sitting here. You're literally sitting in the heart of Silicon Valley,
Yeah.
where that's not necessarily the attitude. I think that's just an amazing quality. And you've excelled in so many ways in so many different phases here. What advice would you give your younger self?
That's, this is going to sound really cliche, but I think the advice I would give my younger self is don't sweat the small stuff. Those times when your parents were like, what are you doing? Or when, I think my mother's illness really put life in perspective for me. And you realize how grateful you need to be every day and for everything we have when it comes down to our health, obviously. And obviously with the pandemic, I think we're all learning that in spades. But I think, a lot of times when we are all type A personalities, we think about our life and we're like, okay, we need to do this and this and this. And I threw that out the window when I went through changing majors. I remember that was a really tough time for me, because it was a hard conversation to have, to tell your parents, like, hey, I'm not going to be a doctor, especially because, as an immigrant child, they put so much faith in you because you're almost a version of them, an extension of them and their future. So more than disappointing them, it was more like the instability that they felt that they would have in terms of who you are. And so that was, I think really, that was for me a moment in life where I learned over those years, and I would say it was not 1 year, it was years, that everything just kind of works out. You have to love what you do. You have to be willing to work hard at it. And, but don't sweat the small stuff, because everything happens for a reason. And if you look back at my life, like the point that we just talked about, the fact that I worked at ABC News, the fact that I worked at the Walt Disney Company, I would have never thought those things would be useful, but they're very useful in the role that I am in today. And I've been able to call on experiences, and everything happens for a reason, and being able to find the beauty and step back and look at, why are those things happening to me today? And maybe that'll help me for something in the future. But really just like, focusing on the big picture and not sweating the small stuff. That would probably be the biggest piece of advice. Cause I remember those days where I'm like, I don't know what's going to happen with everything, so that's, I think, the biggest lesson I would share.
I mean, Sumbul, when you were talking about your mom and this, like, changing majors, I mean, I completely understand, growing up in an Asian family as well, and that there is no like you and them, like you are a unit, and what you do affects the unit. And then there's this beautiful, honestly, story that you just told, is like you broke away, even though the unit, and then the unit brought you back, like, into this next leg of your career in this way. It just, it's kind of a really beautiful story, and so amazing in that way. So we always like to ask this question at the end, but if you wrote your own story, what would the title be?
It would be Breaking Boundaries, or the other one I would say is like really, thinking outside the box, because for me, I've never taken a straight path through anything. I've always kind of taken a path. I have a few titles I guess I could come up with, is, enjoying the journey.
Sequels to your book, obviously.
We have sequels, right? Exactly. I think savoring the journey would be another one. Because I do think, I think if you can step back and look at the fact, at least I feel this way, is the fact that I've been able to take that journey. In a lot of countries and where you get raised, you wouldn't be able to do that. Like, for example, the reason this was so stressful for my family was in India, you couldn't take this path and go back to medical school later in life. It just doesn't happen, right? And the fact that you can savor the journey and have the luxury of looking back at your life and being like, yeah, that worked out for a reason, and I can enjoy those moments. I think that probably would be the title, though I'm not really good at this. So I'd have to come up with I'm going to have to come back the next time with a better title, but that's probably what I would think about.
You have too much material and you just have too many titles because it's the sequels. Well, Sumbul, thank you so much for joining us. We're just so privileged to have you because I think as you said, this path that you've been on in this journey, truly all of these things are coming together in healthcare now. When we think about the consumer first vision, you're, actually being a practicing doctor and now being in one of the most preeminent technology companies. When we think about consumer healthcare and technology, I just can't think of a better leader that truly will put all of this to kind of move the needle and create a new world for healthcare. So thank you so much for joining us. We very much appreciate it.
Well, thank you. And I have to say, I'm always cheering you from afar. You're doing such amazing work that I think will be so pivotal to healthcare. And it's awesome to see you and I were talking the other day, to see you can hear the sparkle in your voice almost, and the excitement in your voice and changing the world. So thank you for everything that you're doing to make healthcare even better than what it should be. So thank you for everything you're doing as well.
It takes a village, right? We're all doing our parts from where we are. And so that's what's been so amazing about this podcast of Her Story. But thank you so much for joining us.
Thank you for having me.